I'm Juno. I'm a GP in Ipswich. I'm also a prevention lead for Ipswich and East Suffolk CCG. And I'm just going to tell you a little bit about the virus. So at the moment, the vaccine has been rolled out in Suffolk for nearly 2 weeks now. The first week, the hospitals vaccinated people, and this last week, or maybe 5-6 days, the GP practices are rolling it out. And you may have heard the term PCNs, primary care networks. This means that more than one practice are working in partnership and beginning to vaccinate their patients and healthcare workers. It really is a question of don't call us, we'll call you. Funnily enough, with the vaccine, there are those people who are just falling over themselves to be vaccinated as soon as possible, and a smaller percentage of people who really don't want to have the vaccine. So we can talk about that in a minute. But those who do want the vaccine, we encourage them not to contact the practice, because of that it'll just make it harder to get through to your practice for routine appointments. Reports have been run, lists have been drawn up as to who is eligible for the vaccine. So initially it's the over 80s who are being in the first cohort, and care home workers, and then that is spreading also to NHS staff. Then it'll become people who are over 75, then over 70, and with those over 70s, those people who were classified as being extremely clinically vulnerable. If you or anyone you know was in the shielding group, that's what they mean by extremely clinically vulnerable to COVID. They'll be done with the 70 to 75-year-old group. The other thing is BAME people. At one point, I was being asked, why are BAME people being guinea pigs? The answer is they're not being guinea pigs. They're not amongst the first groups to be vaccinated. In fact, BAME patients are not being singled out for vaccination at all. But remember, just to clarify that in every one of those risk groups, over 80s, health and social care workers, over 70s, vulnerable, extremely clinically vulnerable, there are BAME people in all those groups. So to touch on Gulshan's point earlier as to whether any particular groups are being used as guinea pigs because of their ethnicity, the answer is no. But we are all part of individual groups based on our age or whatever. So please make sure you get the vaccine, because that is really the only way that this pandemic is going to end. I was meant to talk for 5 minutes, but unfortunately I didn't set my timer as I thought I had, so I've probably got another couple of minutes. So, okay, at the moment then, it's the Pfizer vaccine which is being rolled out. One of the reasons it hasn't been rolled out to care homes in a big way yet is because it has to be stored at -70 degrees centigrade. This is a real problem in getting it to places where it's needed. However, it's a really good vaccine, 95% effective, and rollout to care homes and other vulnerable groups who can't get to the surgery will happen in due course. The second vaccine candidate is likely, in my opinion, to be AstraZeneca Oxford. It's a combined thing which is now being looked at carefully by the regulatory authorities to see whether it's considered to be safe to roll out. Very quickly want to touch on the fact that some people feel has it been rolled out too quickly, because it normally take 10 years for a vaccine to be approved, and this has been approved in less than a year. But even that would be just a few months compared to 10 years. Well, the answer is that all the steps were taken, but they were taken, if you like, in an overlapping fashion. There were loads of volunteers. Normally it's hard to get volunteers to put their hands up and say, I'm happy to be vaccinated as a guinea pig. But loads of really caring people said, I'm happy to stand up and be counted. Give me a vaccine. Loads of money was spent on this. It was prioritized. So the answer is it safe? We can go into it later if you want more detail, but it is safe. Does it pass the mum test, as the Deputy Chief Medical Officer Van Tam asked? The answer is I think it does. My parents, who are both over 80, have had the vaccine already. Very happy for them to have it. My mother has allergies, and she had the vaccine. If you've had a severe allergy where you needed resuscitation or you couldn't breathe, your lips swelled up, in other words, what they call anaphylaxis, you should not be having it. The other very quick question I want to address is, you know, tens of thousands of people have been in the trials, but remember that tens of thousands of people is not tens of millions of people. So rare side effects that affect 1 in 100,000, 1 in 500,000, 1 in a million will not be apparent until it's rolled out. And if you are one of those people who feels more comfortable having something after other people have had it so that you feel that it's safe, then that's not a problem. You should wait, because believe me, there are literally millions of people who would gladly take your place in the queue. But what I would say is, once you're satisfied that it is safe, and remember, nothing is 100% safe. Thousands of people die every year from taking aspirin or ibuprofen, because both of those drugs can cause gastric bleeds. So even though they may help your joints, they may thin your blood and reduce your risk of stroke or heart attacks, a percentage of people will have serious side effects. So doctors should never say that a vaccine or anything else is 100% safe. But what we do know is that it is very safe. The benefits of it far outweigh any risks. And I think I would strongly encourage you to have it when you feel ready to have it. The more of us who have it sooner rather than later, the better it is to end this pandemic and get people back into any form of normality.